Myasthenia gravis, otherwise known as MG, is a rare chronic autoimmune disorder where antibodies destroy the communication between the nerves and muscles. Around 26 in 100,000 people in Canada are diagnosed with MG. MG is most frequently seen in women in their 20s and men above the age of 50. There are two main causes for MG: the antibodies and the thymus gland. The immune system creates antibodies that destroy your acetylcholine muscle receptor sites. Individuals with MG have fewer receptor sites available, resulting in the muscles receiving fewer nerve signals. Your thymus gland is located in your upper chest and is responsible for the production of the antibodies that produce acetylcholine. Individuals with MG could have an enlarged thymus gland or even presented with a cancerous tumor. There are varying different symptoms a patient can experience, such as ptosis, which is a droopy eyelid, diplopia, otherwise known as double vision, muscle weakness, fatigue, change in facial expression, trouble swallowing, weakness of limbs, and/or myasthenia crisis. Myasthenia crisis is when there is extreme muscle weakness, specifically in the diaphragm and chest muscles. It can be caused by a lack of medicine, a respiratory infection, emotional stress, or surgery. In severe cases, the patient may be placed on a ventilator until breathing improves. MG can be diagnosed through anti-acetylcholine receptor antibodies tests, nerve tests, and varying neurological exams. The anti-acetylcholine receptor antibody test is done through a blood test to diagnose any abnormal antibodies. The test can show the presence of other antibodies, so their presence supports the diagnosis of MG instead of confirming it. Electromyographies are a form of nerve testing and are done to measure the electrical activity within the individual's muscles. When performing neurological exams, they are testing the patient's reflexes, muscle strength, sense of touch and sight, coordination, and balance to help with the diagnosis of MG. For treatment of MG, patients can take medicine, a thymectomy, plasmapheresis, or immunoglobulin. There are multiple different treatment options, which will be based on the individual's age, medical history, current health, and preference. There is no current cure for MG, although symptoms can be controlled and managed through treatment options. Steroids or medicines that suppress the immune system's response can be used. A thymectomy can be performed, which is the surgical removal of the thymus gland. Plasmapheresis is a procedure where they remove any abnormal antibodies from the blood and replace them through blood donation. Immunoglobulin is a blood product that decreases the immune system's attack on the nerves. If you or a loved one are experiencing symptoms of myasthenia gravis, please see your healthcare provider for further information.